Good morning, everyone. Today I'm here to discuss about the lipid profile test. So, here we are going to see about the contents of what are the types of lipoproteins present, what are the tests, for what we are doing that, and what are the normal ranges of the values, etc. We are discussing here. So, going to the first slide, lipid profile. The lipid profile is a group of tests that are often ordered together to determine the risk of coronary heart disease, which is associated with lipid disorders. LP is a good indicator of whether someone is likely to have a heart attack or stroke caused by blockage of blood vessels or hardening of arteries. So, lipid profile. Plasma lipids. What are the lipids? Triglycerides, phospholipids, cholesterol esters, and free fatty acid. The percentage they present are 16% of triglycerides, phospholipids 30%, cholesterol 14%, cholesterol esters 36%, and free fatty acids 4%. Clinical significance: diagnosis of dyslipidemia, assessment of prognosis of a non-dyslipidemic patient, to assess the risk of atherosclerosis and coronary artery disease. These are the clinical significance of doing the lipid profile test. So now we are going to see what are the components of lipid profile, that is lipoproteins. What are the lipoproteins? The main lipoproteins, the main focusing of the lipid profile test are mainly these components. That is, first one, total cholesterol, also known as TC. Second one is LDL, low density lipoprotein cholesterol, which is also known as bad cholesterol. And third one is TAG or TG, triacylglycerol or triglycerides. Then HDL-C, that means high density lipoprotein, or it is also known as good cholesterol, which is desirable for our body. First one, total cholesterol. A lipid profile typically includes total cholesterol. This measures all of the cholesterol in lipoprotein particles. Total cholesterol is equal to LDL, low density lipoprotein, plus HDL, high density lipoprotein, plus out of 1% of triglycerides. The normal range of total cholesterol is below 200 milligram per deciliter is desirable, and above that value they are considered as abnormal, and it is categorized into two, that is 200 to 239 milligram per deciliter, it is known as borderline high, and above 240 milligram per deciliter it is high. This value is common for total cholesterol only. Now coming to the point of HDL-C, that is high density lipoprotein, measures the cholesterol in HDL particles, often called good cholesterol, because it removes excess cholesterol and carries it to the liver for removal, where the synthesis of lipoprotein takes place. So it will return to the liver and it is excreted. Normal range of HDL below 40 milligram per deciliter in men and below 50 milligram per deciliter in women is poor, and 40 to 49 milligram per deciliter in men and 50 to 59 milligram deciliter in women is better, and 60 milligram per deciliter and above is the best. LDC, often called as bad cholesterol, because it deposits excess cholesterol in walls of blood vessels, which can contribute to atherosclerosis. We all know what means atherosclerosis, that is the thickening of the arteries which supplies blood, where there will be a plaque accumulation which is formed of lipoproteins, fats, etc. Usually, the amount of LDL cholesterol is calculated using the results of total cholesterol and HDL and triglycerides. First itself we have noted that formula. From that we can calculate the amount of low density lipoprotein present in our body. So these tabular column shows the normal ranges of LDL. Below 70 to 100 milligram per deciliter it is known as ideal, and 100 to 129 milligram deciliter nearly ideal, and 130 to 159 means borderline high, and above 160 to 189 high. 190 or above represents very high levels of low density lipoprotein, which is bad and which is adversely affect our body. Coming to triglycerides, low levels of triacylglycerides can be present in patients who carry genes for familial hypolipoproteinemia, that is an hereditary disease. High levels of triacylglyceride can be present among individuals with metabolic syndromes and risk of coronary artery disease. Very high levels of THG, that is more than 500 milligram per deciliter, can be concerning for the development of pancreatitis. that is the inflammation of pancreas. Note, triacylglyceride is a body storage form of fat and energy. Most triglycerides is found in adipose tissue, that we all know that the fat is deposited in the adipose tissue or stored in the adipose tissue. Provides energy in the absence of carbs, that is carbohydrates, while fasting. If there is no presence of carbs means our body will utilize this triglycerides as an energy. Some triacylglycerides circulate in the blood to provide fuel for muscles, and extra triglycerides are found in the blood after mean TG gut, which passes to the blood and last to the adipose. Elevated in obese or diabetic patients, levels increase from eating simple sugar or having alcohol. Triglyceride test needs 12 hours fasting because its level is affected by meal, fatty meal, high carb meal, etc. Level should be less than 150 milligram per deciliter. High triglyceride leads to the fatty liver, which is the fat accumulation in the liver, fat deposition. The normal ranges less than 100 milligram per deciliter is an optimal, and 101 to 150 is normal. 150 to 199 milligram per deciliter is borderline high, and 200 to 499 milligram high, and above 500 milligram per deciliter, which is mean as very high. Last come very low density lipoprotein, calculated from triglycerides by divided by 5. This formula is based on the typical composition of VLDL particles. Then lipid profile and their interpretation. Component total cholesterol, desired, borderline, high, very high categories are given. So the total cholesterol normal is less than 200. 200 to 239 is borderline. More than 240 is high, and more than 290 is very high. And coming to LDL, 130 is less as desired. 130 to 159 is borderline. Once more than 160 is high, and 190 is very high. Triacylglycerides less than 150 is desired. 150 to 200 is borderline, and more than 200 milligram per deciliter is high, and more than 500 milligram per deciliter is very high. HDL comes, desired is more than 60 milligram per deciliter, and the other is below 40 milligram per deciliter. HDL is the only known anti-atherogenic lipoprotein. LDL is the best known atherogenic lipoprotein, and 70% of the plasma total cholesterol is in fat carried by LDL. Therefore, the ratio between TC, total cholesterol, to HDL and LDL to HDL are more reliable marker for atherogenic risk and risk of coronary artery disease. See, good and bad cholesterol, what you need to know is normal. This is the first, they represent the normal artery, blood artery which supplies blood. Second one is a plaque accumulation where the bad cholesterol is deposited in the interior walls of the arteries, which forms a thickened structure that can lead to the atherosclerotic plaque and atherosclerosis. That it is here, this is the differentiation. So this golden color balls are the examples for bad cholesterol, and green color balls are the examples for good cholesterol. This first diagram is the normal representation of blood vessel. Second one is the atherosclerotic representation of the blood vessel, where the bad cholesterols are administered. So dyslipidemias, a group of disorders characterized by abnormally low or high concentration of plasma lipoprotein. So therefore the values of the lipoproteins may be vary abnormally. That means either it can increase or it may decrease. So that is known as dyslipidemia. And hypercholesterolemia, the name itself suggests that the increased level of cholesterol. It is the presence of elevated levels of cholesterol in the blood. It is a subcategory of hyperlipoproteinemia, which is the presence of elevated levels of lipoproteins combined of fat and protein molecules in the blood, which is itself a category of hyperlipidemia, or the presence of elevated levels of lipids in the blood. The risk factors for hypercholesterolemia. First, the factors influencing the condition are obesity and diet. Second one, genetic factors. Third one, hypothyroidism. Then diabetes mellitus, obstructive jaundice, nephrotic syndrome, chronic renal failure. These are the risk factors for hypercholesterolemia. Here it is discussed about the obesity and diet. High saturated fat and cholesterol intake increases the hepatic cholesterol pools. Obesity causes insulin resistance leading to increased free fatty acid, enhanced VLDL synthesis which is later converted into LDL, reduced LDL receptor expression, result increased LDL cholesterol and total cholesterol. Genetic factors, mutations affecting, mutations means there is sudden change, abnormal change affecting lipoprotein metabolism, LDL receptor defect, familial hypercholesterolemia, ApoB100 mutation, PCS, PC5K9 gain of function, etc. Then thyroidism, thyroid hormones normally upregulate LDL receptor synthesis and stimulate cholesterol conversion to bile acids. Diabetes mellitus, especially type 2 diabetes mellitus, means insulin deficiency or resistance leads to increased lipolysis, that is breakdown of lipids, and which increases the free fatty acids, enhance the hepatic VLDL production. Obstructive jaundice, it means there will be a obstruction in the bile flow which prevents cholesterol excretion, so that there will be deposition of cholesterol. Accumulation of abnormal lipoprotein that can cause this hyperlipoproteinemia. And the last, the nephrotic syndrome, that is massive protein loss in urine triggers compensatory increases higher protein hepatic protein synthesis, parallel increases synthesis of lipoproteins. So that's all for today. It is all about the lipoproteins and the categories and how they are contributing to the risk factors of lipoproteins. That's all covered in this portion and their normal ranges. So we have studied about the lipoproteins types, what are the components involved in that, and what are the normal values and what is the abnormal values. Abnormal values means what is the desirable, what are the high risk, borderline and very high values, and we have discussed about the diseases which can be mainly caused by this alteration in the levels of lipoproteins, and finally what are the factors that are affecting, and that's what we have discussed.